is relatively common, especially as we age. But do you know that sometimes hip pain can mean something else? This is a very important video, especially for our menopausal women. But men are not an exception to this because sometimes hip pain can also be due to a problem in the prostate. That's why in this video, I will share with you 9 symptoms that you should never take for granted with hip pain. Stay with me until the end so you won't be missing out with any of these important symptoms. Hi, this is again Dr. Sherry, Doctor of Physical Therapy, teaching you practical health tips and home exercise programs that will surely benefit and help you. Hip pain can be due to many reasons, and one of the most common causes for this is musculoskeletal conditions. And by that, I mean that the affectation is particularly either in the muscle or in the bone, in which case physical therapy can really be helpful. However, in this video, I will share with you 9 symptoms that will let you look into the symptoms because these might mean something else. Now, you might be wondering why. That is because our pelvis actually houses many important organs, including the bladder, the uterus for women, prostate for men, and even part of our gastrointestinal organs like our colon. And sometimes an infection, conditions in any of these areas can mimic and can refer pain to your hips. This is a very important video because prompt and proper treatment can mean that it can save a life. And you can also check if you have these symptoms for you to gauge if physical therapy is appropriate for you. If you suddenly experience pain in your hip joint, but with no known cause, these can be a red flag sign and this may mean further evaluation. Because typically, when hip pain is caused by musculoskeletal conditions, in majority of cases, you can pinpoint and recall any certain movement, any certain motion, which could have triggered your pain. Hip pain that is exacerbated and worsened 5 to 10 minutes after certain exercise needs further evaluation. This can be a cause or symptom of what we call as peripheral vascular disease or PVD. This is especially true if you can observe clammy skin and also paleness in your affected leg. Try to imagine your blood vessels like roads, which delivers blood into the different parts of your body. Sometimes there are instances wherein these blood vessels are narrowed or occluded either through conditions like atherosclerosis or due to plaque formation and even blood clot. And when this happens, especially in this hip, it can give you hip pain. When hip pain is caused by musculoskeletal conditions, you can actually experience pain, especially after doing certain movements and certain actions, like when you stand, when you walk, or when you go up the stairs. Say for instance, if the cause of hip pain is due to a fracture, patients usually experience pain when standing up. Hip pain associated with gastrointestinal symptoms. If you experience hip pain, plus you also feel discomfort in your belly, if you feel bloated, if you feel easily full, and if you vomit, this needs further evaluation. The cause of this hip pain may not be musculoskeletal in nature. Possible cause for this is a problem in the liver because your liver and other organs in the abdomen, it is actually intertwined by a network of fibers, and any infection, any inflammation in the liver can mimic and refer pain to your hip. Hip pain on both sides of the body needs further evaluation. If you're currently experiencing pain in both your hips, this needs further evaluation because these can be a symptom of an ongoing infection. Now, mind you, especially in older adults, this is very crucial because at times, infection may not be associated with fever, but what you can notice is increased confusion or any change in their mental state. Any ongoing infection in the bloodstream can lead to bilateral hip pain because this actually affects multiple joints at a time. When the problem of hip is caused by musculoskeletal conditions, in majority of cases, it affects only one hip at a time. Before we continue, if you want to know more about helpful health videos, and if you want to know about practical yet very effective strategies to help you with neck, back pain, sciatica, and even numbness caused by neuropathy, that you can do at home. At this point, I would like to ask a tiny favor from you to please click the like button below because it will enable me to share more videos with you. Also, if you haven't subscribed yet, please don't forget to click the subscribe and the bell button below so you won't be missing out with our helpful and important health videos. Hip pain associated with blood in the stools or after using the toilet should raise an alarm and can be a red flag sign. This may not be purely musculoskeletal in nature and this needs to be evaluated because this can be a symptom of hemorrhoids which needs to be corrected or a possible problem in the colon. With colon problems, prompt and immediate treatment is very crucial. Hip pain plus a past history of prostate, urethral, anal, and rectal cancer should raise an alarm and it needs to be properly and immediately evaluated. This is especially true for persons who have had surgery due to removal of tumor within the past 6 months. This is the best thing to do to check your health and to make sure that there is no spread of certain illness. Hip pain together with yellowish or greenish discharge in the vagina or in the penis, either if it has smell or not, should raise an alarm and can be a red flag sign. This needs further evaluation because this may mean to be a symptom of problem in the reproductive system. For women, if you're experiencing this, it is best that you consult with your OBGYN, and for men, please do consult with a urologist near your place. This will allow to really pinpoint the cause of the problem and to give you specific and prompt treatment. Hip pain associated with bleeding after menopause should raise an alarm. It is a red flag sign and you need to have yourself properly checked because this can be a strong indicator for a problem in the uterus. For menstruating women who experience hip pain in between your menstrual period, please have yourself checked also by your OBGYN because these symptoms are not associated with purely musculoskeletal in origin. Lastly, hip pain associated with body malaise and fatigue, where you notice you easily get tired, and sudden loss of body weight without any effort in your side, like for example, diet. And the type of hip pain that actually worsens at night, that it does not make you sleep, this should raise an alarm and should need further evaluation. I also want you to look into this and try to evaluate in the visual analog scale with pain ranging between 0, 5, and 10, with 0 having no pain, 5 moderate, and 10 severe pain. What is your pain scale after using conservative management like oral pain relievers, use of hot or cold compress, and even physiotherapy? Have your pain decreased? Try to specifically evaluate because if not, this needs further evaluation because in majority of cases, if the cause of hip pain is purely musculoskeletal in nature, you can experience relief or decrease in your pain scale when using these techniques. These are 9 important symptoms that you should never take for granted for hip pain, simply because it will help you gauge and check if physical therapy rehabilitation is for you or not, if the problem is purely musculoskeletal in nature. That way, you won't be spending your time and your money, and also it would require immediate and prompt treatment, especially if you experience any of the symptoms that I had mentioned to you a while ago. If you have reached the end of this video, please comment guided in the comment section below. If you want to know more about home strategies that will help you with nerve pain, we have a video here. Check on it. It is going to help you. Thank you very much for watching. This is again Doc Sherry. Stay safe, stay happy and healthy. God bless you.